Greetings. We are going to start the practice of the activities for the structure seminar. The first thing we are going to show you is a simple stretching program which has great application both to prepare patients before certain therapeutic activities and in itself to improve the health and the whole quality of the patient's joints and muscles. I will need a stretcher, a wedge to place under her popliteal area, a cushion, and a patient. My patient, Paqui Bernal, who is my colleague from the international school, lies down. I make sure she's in a comfortable position, and I am going to start doing the stretches. First, the entire cervical area. I will give her a little contact and a gentle massage. On her trapezius, on the scalens, on the sternocleidomastoids. And now I am going to do the first of the stretches. Look, I lift her head, I grab her skull, support it. My elbow on the hip and gently, without using force with my arm, but rather with the weight of my body, I perform the stretch. I will use this whenever I can. Use the force of gravity with the weight of my body so I don't have to exert effort. This would be the first stretch, and I stretch until reaching the physiological limit. When it doesn't stretch any further, that's where I stop. And gently, because sometimes patients get dizzy when undoing this movement. I return, and now one hand on her right temple, another hand on his left temple, and I perform a lateral rotation and stretch her body. I am always attentive to her face in case she makes any expression of pain. Slowly, I undo and the hand on her temple, the other hand on the other temple, and I turn like this. I apply a little pressure and keep an eye on her face. If I see any expression of pain, I stop. Yes. I return slowly. This must be done very gently. And look, I press. Fix the opposite shoulder and use my body to apply force. Without harming my patient, always watching her face to see if everything is okay. And if she makes any expression of pain, I stop. And now, to the other side, gently. I hold her little head, fix the opposite shoulder, and stretch. The facial expressions of my patient and I return. And now look. To do some mobilizations, I will make circles. This is called a circle. This provides a lot of relief, and I make circles in the opposite direction. And this gives me a lot of information about the state of the vertebral joints in my patient's neck. And now I'm going to do 8 as infinity. Like this. See? This is very gentle. This is what I'm doing. Now I grab the back of his neck. With one hand, with my wrist, I grab his chin and let the weight of my body fall back. If I don't use force, no, I pull. I don't pull hard. I simply let the weight of my body fall for a little while. This way I'm stretching his neck. I cover him again and move to his shoulders. Look, one hand on each shoulder. I let the weight of my body press down. And this way I stretch his pectorals and relax the joints. Of the shoulder and the acromioclavicular joint, of the acromion and the clavicle for a little while, and then I leave it still, like this. His hips, the iliac blades. Slowly, a little bit of separation. It's like an opening. Slowly, and now I move to his legs. Look, I grab under the popliteal fossa and at the ankle, at the heel, and I perform circumduction. My patient should relax his leg and hip a lot, so I can make these circles. And in the opposite direction. The same. And now, I am going to stretch. Look how I do it. I place my armpit over the leg and let the weight rest on my body, while I pay attention to my patient, to his face. See how the knee gets closer and closer to the chest, until it reaches the physiological limit. With the weight of my body, I don't exert force, I don't push. I just let my body weigh down, like this. And now he is going to get up. And look at this. Bring the knee to the chest, grab his foot, and I ask him to lift the heel upwards towards the ceiling. Like this. See, this is the engagement of the hamstrings. I help by slightly tilting the leg and he rests. Once more. The heel to the ceiling. Good. Now stretch a lot. Once more, the knee to the chest and the heel to the ceiling. And look, now it's practically fully stretched. This will help her walk upright, not bent over. It will help her a lot. The same thing we've done for this side. The circumduction, the flexion, and the stretching of the hamstrings, you do it on the other side. And now look, we are going to do this and this. The feet pointed slightly in. Separate the two knees and leave them like this calmly. I support my hands and do not apply force. Very light. The pressure is very light, carefully, because the abductors can sometimes be painful. Gently a little. I am attentive to her face, and if she feels pain, she lets me know. Like this. Very good. And now the next one is the glute stretch. With this stretch, I am going to stretch her glutes. She will feel it pulling on her glutes. If you notice it here, see, gently. A little pressure, but not much. This is delightful. It leaves your back, lower part, and glutes super relaxed. Yes. And now we are going to do another stretch, which is a yoga pose. Look, like this. And this. And look, as you can see, observe carefully that the arm on the side where indeed those knees are down but placed upwards at precise 90-degree angles. And like this, no work, nothing, I let go and gravity does the work. I am stretching it. The entire lateral muscle chain and the pectorals, and I just let it be. It's a yoga pose. It's called Subhiya, Svastika Asana. And it's a very popular pose in Hatha Yoga. And I stay like this for about a minute and a half. And I'm going to do it on the other side as well, okay? Now I undo the pose like this. I uncross the legs and we switch to the other side. And we stay like this, although simple. This position is excellent for stretching the iliotibial band, the tensor fasciae latae, the hip, the quadratus lumborum, the closed muscles, the lats, and the pectorals. It provides a lot of serenity. If I tell my patient to imagine they have a sun here in their chest, it will relax them even more. It's called Surya, which in Sanskrit means light or sun. Here I place the sun. Surya is vast. Asana. Let's undo the pose. Like this. Very good. And I would stay. Doing flexions and stretches of your feet. Look, if you don't apply force, I stretch. And over here stick. And over there I stretch with the weight of my body. And over here I stretch with the weight of my body. And like this several times. Circumduction to one side. Circumduction to the other. I would do the same. On your left side, and now I'm going to ask my patient to lie face down. Crawl. Look, it's called the bear step. This is a delight, it's a blessing for the patients. I do it with the strength of my body, exercising it like this. When we do these kinds of things, we must take into account the culture and religion of the people. If Paki were of the Muslim religion, I wouldn't be doing this because her religion wouldn't find it appropriate for me to be massaging, for example, her legs or her glutes. But since Paki is not Muslim, well, we don't have that conflict of beliefs. But this is delicious. It's super relaxing. The next is swaying. Look. I am going to place over the sacrum. I place one hand, then the other. And now I look for the natural movement of her body. And I am applying this swaying, which is a massage for the entire central nervous system of my patient. all the nerves that come out of her spinal cord through the vertebral column are receiving a massage and are relaxing and distressing while enjoying the soothing ambience. I do it gently, you see. It's very gentle. I am doing it very gently, with just one finger, with the hand. I don't have to use force, it's just like inserting it. Okay? And the next thing that I have left is to grab her feet and stretch until my patient lets me know. Gently, with the weight of my body projected there. If it's a sturdy person, I can do this. And with the weight of my body, I stretch. Since Paki is a young woman and exercises a lot, she's very flexible, so I have no problem applying the stretch and a little bit of circumduction for her knees. And now I do the Soto maneuver, which involves stretching and mobilizing the sacroiliac joints. See how I do it? I grab one hand under the knee, the other on the foot, and I do abduction, ham, elevation, and return. Separation, denial, and return. Separation, denial, and return. Separation, elevation, and return for separation. Elevation and return, and 5 is the maneuver. Soto. Then they will integrate it for the work with the Yarnet's osteopathy. Face up, please. Yes, this is the basic series of stretches that, as I mentioned, serves to prepare the body. It is a treatment in itself, very relaxing, very therapeutic, because it stretches a lot and serves as an introduction to other types of maneuvers. I hope it was helpful to you, and I send you a big kiss.